the way we structure the whole platform is by connecting three important, let's call them actors in the healthcare ecosystem globally, right? One is you've got the patients, and the patients do not have an access to a marketplace, but that's what they need, right? Patients need to be able to have the power of choice, to be able to see on a healthcare marketplace what is available, at what price, in what location. Is it available through telemedicine? Is it available through home care? Or do I have to go there? They should be able to see the reviews of other patients, and they should see a clinical rating of this provider. So all of that transparency comes through the marketplace, which we have, as a website, as well as a mobile app. Because, you could be, for example, you could be living in a high cost of care country, right? You could be living in a country where the cost of care is super high, but there could be a more affordable option in another place that is just across the border, right? And you could just simply go there and, for example, get a much cheaper insulin injection at a fraction of the cost than compared to the country in which you're living. And for some people, that is a life and death choice. So the marketplace really enables that to happen. It gives the power of choice back to the patient. On the other side of the platform, we have the healthcare professionals. So here we're talking about nutrition, wellness, and outpatient care. And later we will also get to inpatient as well. If you're a healthcare professional and you're not connected to a marketplace, you will eventually be out of business, because the patient is the one who has the power of choice. Doesn't matter who pays. They are the ones who have the power of choice. And if they can't find you on a marketplace where they can't see your reviews, they can't see your price, they can't see an easy way to connect with you and book an appointment, then you as a healthcare provider are essentially going to become obsolete. So there is a need to plug in to a health tech platform, which is what we offer through Ponea. We have different cloud and mobile applications for all the various healthcare professionals. And through that, they connect to the marketplace. Then we have the third piece of this whole healthcare ecosystem puzzle, right? Because we're trying to solve this whole thing in one go. We're not trying to solve little pieces of the ecosystem. We're solving the whole thing in one go. So you've got your patients, you've got your healthcare professionals, and then the third piece is what we call the partners. So the partners in healthcare can include insurance companies who are selling insurance to patients as well as to the healthcare professionals, like indemnity insurance. It can also be financial institutions which are providing a loan or savings product around healthcare. It can also be grant and donor institutions or philanthropic institutions who are trying to channel funding to the most vulnerable populations in the world who do not have access to healthcare, but yet they waste so much money in the administration of those funds getting to the right people, right? And not have real-time transparency or reporting around what exactly is happening with their philanthropic contribution. It can also be employers, right? Like if you've got a company of a few dozen or a few hundred or a few thousand people, making sure that that employee base is healthy, mental, emotional, physical, all types of health, so that they are coming to a workplace where they can be productive, is again an important responsibility of employers.